I mentioned, there are two speakers we have on our agenda today who are a little bit delayed, but hopefully as we go through the press conference, they will be here. But let me just start out by saying thank you all for coming. My name is Rev Liebman. I'm the Director of Organizing and Advocacy for New Jersey Citizen Action. We're here today to announce the beginning of a new, very exciting movement in the United States to win a guarantee of quality, affordable health care for all, and our campaign is called Healthcare for America Now. Today, here in Trenton and in 42 other state capitals and cities around the country, and in Washington, D.C., men and women like you see here today, organizations from all over this nation, are coming together to say that this is the year that America decides. In 2009, we will either have a guarantee of quality, affordable health care we all can count on, or we will continue to be at the mercy of the private health insurance industry that is charging us more, giving us less, and putting company profits before our health. Today, here in Trenton and in communities all across the country, we're asking one question of you, of our elected officials, both at the state and national level: which side are you on? Are you on the side of quality, affordable health care, or are you on the side of being left alone, fencing yourself in a complicated, bureaucratic insurance market? Healthcare for America Now is a national grassroots campaign organizing millions of Americans to win a guarantee of quality, affordable health care for all. We are grounded in organizations that can mobilize people at work, at home, in their neighborhoods, and online. We're bringing together community organizers, nurses, doctors, small business owners, faith-based groups, organizations representing people of color and seniors who believe it's time we had an American solution that provides quality, affordable health care for everyone. We're offering a bold new solution that gives you real choice and a guarantee of quality coverage you can afford. We have materials that describe the campaign in more detail in both your press packets and on the information table over there. We are offering a plan that allows you to either keep your current private insurance plan if that's what you prefer, pick a new private insurance plan if that's what you prefer, or choose to join a public health insurance plan so that you are not at the mercy of the private insurance industry anymore. You'll get a guarantee of standard comprehensive benefits that meet your needs, and you'll pay for insurance based on what you earn and what you can afford. In our vision of healthcare reform, the government works for us, setting and enforcing rules so that insurance companies put our health before their profits. In our vision, people have a choice so they are not at the mercy of the private health insurance industry. In our vision, quality goes up and cost comes down. In our vision, we get rid of enormous inequities that we see every day in our healthcare system for people of color. And in our vision, health insurance is affordable for every American and for every American business, whether that business be big or small. We launched this vision and this campaign with press conferences like this all across the country and in Washington, D.C. We launched with emails sent to 5 million homes this morning. We launched with a national advertising campaign that right now is worth $40 million on cable TV, in newspapers, and again online. Americans know it's getting tougher to get good, affordable health care, no matter how hard you and I work. Even if you take responsibility for your care and make good choices for yourself and your family, there is no guarantee that you'll get what you paid for. We need an American solution to the healthcare crisis that guarantees quality, affordable care we can all count on. One thing is crystal clear. We want healthcare reform that works for us, and we cannot trust the health insurance industry to make it happen. We cannot trust so-called reform proposals. We don't trust proposals that rely more on private insurance, proposals that tax our health benefits at work and force us to get health insurance on our own, proposals that give us a tax credit that pays for a fraction of actual health care costs, and proposals that don't regulate health insurance practices, premiums, or profits. So that is the choice for America. That is the choice that our country faces today. This is the choice that our country and our voters will face in this year's election. Do we want quality, affordable health care for all, or do we want to be left on our own with the private health insurance industry? Here in New Jersey, we will also be asking our representatives in Congress to make that same choice. Hundreds of members of Congress across the country are going to be asked where they stand, on the side of quality, affordable health care for all, or on the side of the insurance industry. Today we have with us people who are representatives of various organizations who have already made their choice. We have organizations that represent millions of people in our state. We have doctors and nurses, seniors, hardworking family members, and people who, like so many Americans, have a health insurance nightmare. The time is now for American solutions that secure our families' health and a healthy economy. What we want is that the first order of business for the new president and Congress in 2009 should be passing health care legislation that guarantees quality, affordable health care for all. Today we start the movement to demand and win that promise. We have several speakers with us today representing the diverse organizations that are part of this exciting national campaign. And after you hear some brief remarks about who they are and why they joined this campaign, we'll be happy to take questions, whatever you have about the campaign, what we plan on doing next, and those kinds of things. So our first speaker is the Rev Bruce Davidson from the Lutheran Government Ministries here in New Jersey.